Anybody, all there to approve the minutes from last meeting? My favorite part of this meeting.
Motion to approve the minutes as written.
Okay,
Second,
all right. That's all that this.
You're actually supposed to vote on that, Roger. Actually, after they make the motions, you're supposed to actually ask for a vote from the group, according to Roger's rules.
Rules of.
Yes.
Robert-
We've never done it, but that's what we're supposed to do.
No, Roger.
Well, whatever it is, whatever rules, we're supposed to do it.
Any opposed? How's that?
Perfect.
Perfect.
Thank you so
Okay.
much. Now it's official.
Okay, with that, I guess we'll turn it time over to Captain Schultz, talking about what's coming up for after the legislative session.
yeah, so, Roger asked me last week if I could talk about really the law enforcement stance of what this means, moving from 110 that decriminalized, small amounts of fentanyl, methamphetamine, cocaine, and then moving into the next stage, which is going to come in September. And when I was looking at it, I kind of wanted to just stay away from the politics because this is huge political things. I have my own personal beliefs, and I know everybody in this room probably agrees on some of it, all of it, none of it. And so I wanted to stay away from all that. And I only have about 12 minutes, right? You said 12 minutes.
Take as much time as you want.
Because, you know, the longer time you have, the more time you have to get in the politics. Yeah. And we have Patty here that has been, she's one of our leaders in our community regarding it. So feel free to jump in on what you know, and
I've already jumped in once and I got in trouble.
you're more than welcome. But it's difficult, because this is a big change, but it really is a perfect thing for this group to talk about because it is a huge change in Oregon law, huge. And it's much more complicated now than it was decriminalizing. Because there's a number of companion laws and bills that make this whole, moving from decriminalizing it was still a violation, but it was not criminally violating to what it's going to become. Not the same as it was before 110, but it will become criminal. And so I just put a couple slides together. If we can go to the next slide.
Clicker for you.
Oh, thank you.
Has she actually signed the bill?
Yeah, the bill signed it.
She has signed.
Moving on, yeah. You've had, Steve Gunnels has been in the news quite a bit, regarding talking about it and, having his political mind. I did a press interview with Central Oregon Daily. Did any of you guys see it? Oh, you saw it, yeah. Because, much of this will be, what is the impact on jails? And, I'm not in charge at the sheriff's office of the detectives or the patrol. I do the courts and the jails, which is the biggest section of the sheriff's office and what that impacts into the jail. And frankly, I'm concerned, because I know it's going to be more work for us. And we're generally the last to get funding from state and federal government. And I have my own beliefs about that. And maybe I'll share my beliefs. It's not political. It's just what I think jails should be in the future. Let's see. Nope, that's not it. That's not it. That's it. Nope, that's not it.
I could just.
Yeah, I only have a couple slides. Is it not working?
I just tested it. There you go.
There you go. Okay, and I just put kind of what the measure is in 2020. It seems like it was longer ago, right? 110 reduces the penalty for possession of controlled substance. And it moved it from class A, felony level, class A misdemeanor, that could be punishable up to 364 days a year in jail, or a fine of $6,201. So it has moved it, to that, and it moved it into a class E violation. And that's, you know, in reality, that's what, when you look at the ORSs, we follow the class C misdemeanor, class B misdemeanor, class A misdemeanor, class C felony, class B felony to class A, which would be murder, all the way up and down. But it created a new category, class C violation. So it'd be $100 fine. And in lieu of the fine, if the person, under the law, if the person completed a health assessment at a addiction recovery center, then that fine would go away. And they could just do that anytime. Law enforcement would show up, they issue a citation, tell them that, hey, if you want this citation violation, all you have to do this, they have to report to a clinic. And they may have reported to one of your clinics. I don't know if we have anybody in their room that, you know, if they called. And in reality, there was some discussion that wasn't really figured out. What does that mean, an assessment? Sometimes it meant just a phone call, and then they would be clear of that charge and move on, which enabled police officers to still confront, but in reality, there was no teeth to it. So whenever a police officer went up to somebody with small amounts of drugs on them, generally it was just they just talked to them, hey, could you move that somewhere else? Could you go somewhere else? And really, there was no enforcement action whatsoever regarding it. And some of the politicians will say, and with that, there was no accountability. There was a push to do the accountability, and then we went into a lot of discussion. And I know our commissioner's been in a lot of those, and I know our representative Jason Kropp and many individuals, police chiefs, our sheriffs, the Sheriff Association, our DA has been in there to try to figure out what are we going to do. Now, you know, in my reading, people will say, well, if we hold them accountable, we'll solve homelessness or we'll solve them getting on the street. I don't think that's probably true, right? It won't solve those type of problems. And so the legislators talked about that. And with that being talked, there was a whole bunch of other bills that came through, but it moved in. If we want to go to the next thing, let's see if I get it. Okay. So the next one, the bill that we're talking about is right here. And if you haven't done it, and you being in this organization, I would take a look at it. It's a thick bill, right? Has anybody really scanned it?
Pass it around, making sure it's back on your.
I've got them up here. You can take my copies if you like. You won't be able to read it, so I'm not going to pass it here.
Okay.
It's huge. It would take you a week to go through it. And I have highlighted things and have to go back because there's a lot in it. And it's not the only bill. There's companion bills. We'll talk about that.
Yeah, one of them is 65 pages and the other one, 5204 is another like 10 pages. And actually, according to my phone, we're still waiting for the governor's signature.
Oh, we are.
So she said she will sign it. It just has not technically been signed.
When will it be signed? Thank you for clarifying.
Well, I don't know. According to what I thought I'd heard, it would maybe be effective the 1st of September.
Right.
It's not an emergency. It's not being signed in an emergency.
Yeah, and that's what I'm getting, that once it's signed, and she said she signed. So I'm glad you looked. Technically, it's not been signed, though. Correct my information, which is all right here. But what it will do once she signs it, it will move the individual, that bill from a violation, a class E violation to a class U violation. And a class, and I want you to remember this, unclassified misdemeanors in Oregon, unclassified misdemeanors don't specify the misdemeanor class. So it doesn't say this is a C, B, and A, because all those classes gives the judge and a DA and the jury what they can sentence on and how many days and what the fine will be. This is unclassified, but what they did put in there, and we'll talk about it here in a minute, you'll hear them say this is a U misdemeanor. So it's a special category under the law. And let's see what that says. The amendment also adopts language for House Bill 4120. That's another bill that they call a companion to this 4002. And that's about money and revenue that will go through. So under under the House Bill 5204, that's the budgeting area that attaches to 402. And that directs, in the bill, directs about $200 million shovel-ready projects. So what does that mean? There's already projects already built. If you remember, 110 was criticized quite a bit because there was just no services for all these people, and they lingered, and beds were filled. And we see that certainly from the jail side. You know, when we release somebody that has huge addiction issues and we want to do a warrant handoff, there's nowhere for them to go, and we're just giving them tents to go because that was the only place for them. But of course, we have our stabilization center. Holly's not here today, right? And
She's not here today, but she is going with me on Monday when we go for
the thing.
analysis.
That would be one shovel ready. That's one that we're used to. The jail's right next to it, and it helps quite a bit. Who else knows another shovel? There's the recovery center that we've got, wellness centers all over that have been popping up. Ideal Options, one of them, Mosaic Medical, all these
Best
places,
Cares.
Best Care, are all popping up. But again, I put in there unclassified misdemeanors in the state are unclassified. They don't specify class, rather they provide a penalty for that particular offense. And under this offense, under Class A, there could be a monetary fine as well as jail time, 180 days, if you violate that. So what does that mean to you guys? So as a police officer, when I did patrol, you pull up on individuals and you would see some type of thing. Normally, even before the measure 110 came, before that, typically possession of a narcotic, of one of these type of drugs, fentanyl's new to the scene. The old drug would have been cocaine or methamphetamine. We'd pull up, nobody really charged for possession. When we pulled up, there was always something else going on. There was a fight going on, somebody's in the street, somebody's unable to care for themselves because they're so drugged out. So we had welfare checks. Somebody was selling the drugs. Delivery is very important to us because we feel that, you know, the drug addicted person, it's very difficult to get them off. We already knew before the policies were implemented that getting them help to get them off the drug was great. Now, if you're selling it, that's a different thing because you're hooking all these people in, especially children. With the law, and I know there was a lot of push to get to the C, to get to a B, to get to an A misdemeanor, which would require more teeth. The bill that the governor may sign is going to be the U misdemeanor, and that gives a lot of leeway to not only to the officer, but it gives a lot of leeway to the DA. And it gives a lot of leeway to the judge because it can go depending on what your issues are and how many times you're using the drug. And if you're conforming, because the whole goal is to say, you know what, we know that you're not going to get help by yourself. There has to be some teeth to it. And by changing the law, we'll allow the courts to enter in. And some people will agree with that and some people don't. But the criminal justice system can force people to do that, or the outcome will be jail time or potentially being supervised by a PO. So like I said, I wanted to put that in. Does that make sense to everybody? And that's really all that is. It just moves it into. So when I pull up on somebody, I'm going to look at what their behavior is if I have to do it. If they simply have drugs on them, small amount, sometimes I'm not going to cite them. I'm going to ask them to stop doing it. I'm going to move them away. Very few times on a Class C felony, people come to jail. They get citations for the most part. Under this law, they can get a citation. But they're probably, officers aren't going to be bringing them to jail. Now, they may interview them, say, where'd you get it? Who's using it? And then we go after the bigger fish so we can remove the product from that area. But they certainly have the ability to do it. Under these other laws or other bills that are coming through, like 5402, there's some things I wrote in there what I see that's coming through. I got this off one of the kind of false lawmakers. The money's already being directed to these things, and money will be directed to the jail. money will be directed to our health department, money will be directed to parole and probation. Because the whole goal is they want our criminal justice system to work together to try to solve the addiction issue. The first piece of this legislation, and you'll see it in the bill, is they'll call it deflection. And so what does that mean? What that means is they want law enforcement to think about deflection, and we already use the stabilization center for that. We use ideal option many times for that deflection, because there's not much, there's not much class C misdemeanor is going to do to change behavior. Many of them expect to come to jail, and they've been in our jail in the past. And I think lawmakers don't want to fill up the jails with them. I do think we're going to get more people. Do you have a question?
I just have a clarification because I've been following you on the class U misdemeanors, but you've mentioned a couple of times class C, and I don't know how you're using that interchangeably or.
Yeah, well, so a class C misdemeanor comes with certain requirements. That's 365 days in jail, $6,000. The class U doesn't, it's less than that. It comes.
Class C was in the 110 measure.
Class C was not in the 110. The 110 measure put it to a class E violation.
Okay.
It moved it from the old class C and redirected with language for it.
So we still have a class C.
We still have.
And we're gonna have it.
But it won't be for low level drugs, a small amount of drugs. Because nobody wants to see a person who has a drug addiction just going into jail. That's going to tie up and with drugs so prevalent now, you can get it anywhere. You can get it all over Bend. You guys all know that, right? You may not be your group, but I could go today and buy a whole bunch of drugs if I wanted. I talked to our code guy, Sergeant McLaughlin, who works our code, and I said, in Portland, the Portland police officers, and that's where I'm from, they're seeing fentanyl going for 50 cents a pill now, which is very low. So you can get it, and if you have more than 10 pills, that they call it dimers, they call it boats, they call it yachts. How many you have, in the drug culture. Things over that pushes it into the delivery section, and that this bill actually comes in with more punishment for that because they want to get the person selling it, get them off the street. In Deschutes County, Sergeant McLaughlin told me, for a 1 pill of fentanyl, it's about $8 to $10 here. And of course, because they have to drive to Portland, that's where the hub is, and then they bring it out over here. That's kind of all I wanted to talk about because this is forming and there's going to be a lot more information regarding it. I don't know if I have any more slides to it. So I kind of just wanted to get into really what's coming down and what we're seeing and how it's changing, as well as staying out of the political atmosphere, whether you like it or not.
So do you see a big increase in your population? Do you need staff?
Yeah, so in the news article that you saw me, thank you for watching. And I said, there is not one jail community in the state of Oregon that's not worried about this, because we know with this teeth, which I'm hoping changes behavior, because that's what we want. We want people to stop doing it, because I don't think we're doing much on interdiction of taking the drugs out of the community. I have defense attorneys going to me and saying, why don't they just go and stop that drug from coming in? Well, that's very complicated, and that's political, right? Yeah.
But I did actually get a fabulous report from Andrew Doyle, who's probably the leading person, works for our DA's office. And he said the latest HIDA report that he had just looked at this week, 95% of the drug dealers that have gone through Deschutes County are actually in federal prison now, the dealers. So I know, he said, Patty, we're way ahead of the rest of the state. Our DA, Steve Gunnels, worked in code a long time ago, so he understands. And that was Andrew. And so on Monday, we have an amazing team of people going to here with the CJC. They've got the funding. They're gonna give us half the funding, but we have to have a plan in order to really, help. And we have some great programs here. Ideal Options is run by Josh Lair. And Josh was a user at one time. I personally know him, and he actually testified that we had to do something. Best Care that had lost one person a year from drug overdose. These are people that they've been working with, had, I believe the number was 26 overdose deaths last year. So these are even people that are getting help. I mean, fentanyl is it's so dangerous. So, and they're, putting it everywhere. So I think we're in a good spot. I know that the people from our health department work really hard on this issue. And if we can just, actually keep hoping, and thank you for being at our jail and being the person you are. It's really
Yeah.
appreciated.
Right, and remember, my fear, and we'll get some money for MAT. We already got the money for MAT through Ideal Options, a grant. And hopefully that money keeps flowing to us because it comes from the state of Oregon. And they've been routine to cut those monies or slim it down to where it's more of our tax dollars having to. Because you get a good program, they start it, and then they wing us off from it. And then we're trying to pay for all the services we have to do. But remember, the jails were never built to be hospitals. And, I look at, when I was young, ambulance driver, really, they just show up, really, they were just transport people. They put a Band-Aid on you and off to the hospital you go. But look at an ambulance driver, they're as good as any doctor today. Jails are being forced into really become hospitals. And we foresee this, and I think we're gonna hear more sad stories about people coming in that are sick, suicidal ideations, packing in drugs when they come in, overdosing. We're just gonna see that, and that's always highlighted. There's always suicides in the public, weekly, monthly. There's overdoses in the public, but if it happens in the jail, you're gonna hear about it. It's broadcast for about a year as they keep bringing it up. And so we're worried about that, and we're not necessarily prepared to be able to take care of all the issues of drug users that come in with tremendous amount of issues. Betty?
I just want to compliment Captain Schultz. Deschutes County and Marion County were only the two counties in the entire state. We have 36 counties that actually have the program. We've had it implemented for a long time. Thank you for taking on that responsibility with Ideal Options working in our jail. So we were one of two counties. We were way ahead of the curve, and hopefully we'll have continued funding.
Yeah. And, one of the things for the jails, we've talked about public safety campus, Beth. I think I've mentioned that in our group about remodel, because one of the things we need to do is, I've always, I guess this is a political thing. I've always felt that I've worked in dungeons my whole career because they're just terrible places to work. And we've really built them for hardcore criminals. But the individuals who are getting in now is just sick people. And we really, go ahead.
Well, I'm sorry, I didn't mean to interrupt. I just wanted to be next. My question is about drug courts and bringing those back. I was a part of our drug court program here for almost 7 years, and I know it went away last year. But any chance that this will help resurrect our drug court program?
I've met with Judge Ashby, and I've met with other partners, and the Sheriff's Office is a big supporter. We get money to finance the mental health professional that would interview these people. And if you remember, the drug court took a lot of time and effort, and it was a small amount of people that were coming through. And then one of the real reasons why we got through, because we had funding for it. Sheriff's Office was gladly paying their share. We were getting grants, but we didn't have enough community members to do it. There wasn't support set up for all the service that needed to get that group in. So with that being said, the judges said, we can't continue doing this. It's a small group of people that are going, and it was really impactful. But we have moved to working with our politicians and the courts to, instead of focusing on drug court, we focus on court connected programs. And it's not so intense, because in order to do a drug court, the one that the one that has best practices. It was a year-long program for everybody and very time consuming, very costly. And we don't have the resources in Bend, not now, probably won't next year until the economy changes and we have more people applying for jobs for certain sources. But if the courts already have court-connected program, like the Veterans Court. You would think, oh, these are veterans that have crimes. No, these are veterans with drug addiction. So that those programs are already working. A judge will see an individual and under this plan that gives a tooth, will give them money to say, all right, you've been in my courtroom now 3 times for possession. You've been on probation, you've been supervised, you're not getting. If you don't change, I'm gonna sentence you to jail. Yeah, you know, and that's a big tooth. Nobody wants to, oh yeah, I'll just hang out in jail for 6 months. They can sentence them with all these programs that are coming in that we've got on our, you know, that are being funded. The judge will have a court-connected program to one of these treatments, and then we push them into those areas. But I did like drug treatment. It was a great program, solved a lot. It just became kind of very difficult to manage. What did they tell you? When it went away, what did they tell you why it went?
I mean, it was established for a long time. I mean, I was part of it for the first 7 years and it continued on, I think, for another 7 after that, but I do think.
You don't want to go back to it, do you? Because it
Because
actually works and what it did is it kept families together.
I think that's
That's so important.
Yeah, it was. I mean, I will say, I had a client I ran into that I saw that I helped manage in drug court. 14 years later, she maintained her kid, you know, with custody with herself. He's graduating. She's maintained employment. I mean, I know that's one example, but it was a very effective program. But I hear you, it was pretty costly because it was a lot of wraparound services. But I do think the monitoring, the support, the involvement of all the community partners is what helps them be more effective longer term as opposed to kind of short term. And then they kind of go back to, you know, what they know. So it was really effective in my opinion. Of course, I'm biased having been a part of it a long time in mental health court. I was part of for 10 years too. But I do think over time, the community partner engagement kind of started to wane and they did kind of recognize that they were putting in maybe additional dollars that they couldn't keep affording to put in, and there wasn't really money coming just to drug court. Like everyone was kind of having to contribute their own budget toward it. So I think it just unfortunately fell apart over time, but it was.
I was told that actually we didn't have the people to run the program because I thought the money to me was there. They just didn't have the people, they didn't have the qualifications in order to run the program. And they needed those people, the people that applied to run it didn't quite meet it. Judge Crutchland and I talked a lot about it because I saw what it did. Sometimes it took 18 months. Sometimes people would relapse, but then they'd come back again. And it means you've saved a family. You've kept somebody working. I mean, what do we want to do? From what I've seen, people that have to do urinalysis for 5 years, at the end of 5 years, there was a study in the 90s, and the people that wanted to get off drugs and the people that didn't but had to, they were both about the same after 5 years. So you've got to do that constantly, the positive reinforcement for, you know, a lot of my research. And I would really wish we could bring that back again.
It's supported in Oregon, the program, there was a huge criteria to even get into it. Children were one of them. But today the addiction rates are off the chart for people coming in. We estimate 80% coming into our custody are addiction issues along with mental health issues.
80% of people coming into the jail now.
Yeah, we used to say 30%, 40% mentally ill, but when you combine addiction issues, it's about 80, and that's what the federal government's saying for most jails.
I just have a question of ignorance, really. When a person comes into jail, are they provided a MAP service? And if they are they provided detox only, or are they provided some opportunities for maintenance?
So, you know, MAP programs, if you've not been through one, I mean, it's a process. So you come in, you have addiction, we survey, we have a nurse meet with them if they want to get on it. You don't get on it right away. Because a lot of people will say, yeah, I'm on MAP right away. But when we do a urine test on them, we realize they may be on it, but they're also taking all these other type of drugs. So you have to wait a certain amount, like 3 days, to get that out of their system. So then you can start them on a MAP program. Otherwise, if you start Sublocade right away, you guys all, many of you, and I know Lee knows quite a bit, Sublocade and all the drugs, you could put them in, you could kill them by starting the withdrawals too soon. It's devastating, it could kill them. So it's very difficult to get them in. Nobody comes right into jail in the first hour and says, boom, here's your Suboxone, here's your Sublocade. Some of them have to go through the process. Then we bring our provider in, Ideal Options, interview them, see if they're a good candidate for it, see what their COWS scores are. Do you guys know what COWS scores are? It's a system they use, Lee knows all this, to determine what the withdrawals are. Yeah, so you know,
So I know in California, they'll only detox, so I don't know the process, I've never worked in that, but somehow they do kind of like a hard detox.
yeah, and we want to avoid that if we can, right? Anybody doing a hard detox, but sometimes you have to go through a little detox to be able to get through it. I mean, these drugs are
And they
potent.
just bring them
Yeah.
down, that's what I mean by it.
Yeah.
Yeah, okay, thank you.
But I think, Roger, I think in the future, it'd be nice to know as these bills come through and we start hearing it. Steve Gundel was on the news talking about we need to bring once this is signed and once we start going through it, we need to bring our community and determine how we're going to do it, because it's very subjective. Because a lot of people, it's all worded on the thing of deflection, which I'm a big supporter of, because I know I can't take care of all these sick people in our custody. So deflection's important to me, but at the same time, I want the bad guys off the street. I don't want children 18 years old or 16 years old to get out of school and be confronted with the choice having to take drugs. Should never happen, should never even have that ability to. That's what the public defenders are saying. They wish it would just not be here. We know the minute we have drug addiction, if we're putting everybody into prison and we stop the cartels from bringing it over, the drug price is going to go up. Well, I'm okay with that. We saw that with methamphetamine when we put pseudoephedrine behind the counter. Prices went up, but less people were able to buy it. More crimes may have happened because they'd have to steal more to be able to provide it. But eventually it wasn't offered to everybody as it is right now. And fentanyl's in our community, like it or not, it's everywhere. Anybody can find it. All the kids know where to get it. If you don't think that, the high school kids know. And that's just a very sad state of Oregon right now. And not just Oregon, or the whole United States. Did I do a good job of not going?
Sure did. You made that clear for me, because as somebody who's only been here 4 years, it was very confusing.
Yeah, it is.
And I did read, when I was here to vote, however, I voted for it, and I did read everything, but it was very confusing.
So it's moving into a class U unclassified misdemeanor that legislators are going to say 180 days with probation. But the whole goal is to get them into treatment. That's their teeth. And then with that one bill, there's like, how many do you think? There might be 5 of them out there that try to support these type of measures of bills, House bills coming forward. Some have been signed, some haven't been signed.
To me, they did a pretty good job of balancing things.
Yeah, they're concerned, and they're, our lawmakers, you have to give them credit. They're addressing the issue. My opinion, I don't know if it's going to solve the homelessness, the unhoused. But it certainly will give some folks the ability to step up, and that's the key.
Thank you, Mike.
We can talk later.
Do you think it will?
Yeah.
Patty? Do you
Do I think it will?
it will solve homelessness?
Do you know how many millions of dollars we've spent on homelessness? I mean, millions of dollars. And I know the point in time count is coming out any day now. I've heard some words on it to solve the homelessness. It's an individual, each person needs to be treated individually. And I really hope that's what we're doing. It's something I worry about all the time. But then I worry about all the people that live around China Hat. And when I was told this Tuesday that somebody was out pouring concrete on public lands in China Hat, And so I checked with some other people that do that major, they brought out tons, you know, that land group, and they said, oh no, they've seen it before where people actually out there were pouring concrete. They're cutting trees down, other things they're doing. But I worry about all those people that, hear gunshot wounds or gunshots every night, and the bullets are going by their head. So, yeah, I don't know. I know I'm trying.
No, I know you are, and looking at the work that I think they're doing the best they can, and I'm proud of them, and I don't have any criticism. Because I know they're all passionate about their different issues that, like I said, some people think we should keep it the same. Some people we should change it. I do think that this will give some individuals the step and teeth. If you look at the Central Oregon, Shonda from Ideal Options, she's one of my mentors that come in and we do warm handoffs to her. She was one that got caught up into the drug methamphetamine, and she would never have gotten changed unless she had law enforcement contact and went to jail, and that changed her. And she was doing Sublocade, and it was really taking her cravings away, and now she's giving back in tenfold than what she took out. So
No, I've met people before that said that I went to prison and it saved my life. And somebody I know that went to prison 10 years ago, and she posts it every year, and I tell her, thank you so much for giving hope to those people out there that are addicted. And it's so hard to get off. So, let's hope that we can. And thankfully, Ideal Option, I think, is doing a great job. And I know Best Care is really, and then there's a new group that was mentioned today that's in the community. So I feel like we're really, and to hear you say there's 80% in the jail with mental illness and substance use disorder, that's almost 100%. So you've got you've got a big job.
yeah, and I worry about my teammates that are going to be there for a while, but because you can't, I really think though in the jail system we could build ourselves out of this with trauma-informed housing, bringing the outside in. I think we need to start working on that around the United States, but we haven't sunk much time into the jails. We've always it's been they're the place that can't say no to people, and they've helped a number of people coming through, but it's very difficult. But we're getting some money out of this. So around the 36 counties, I expect every jail system to be able to do an MAT program. The problem is they may not find people to be able to do it in their jail. Some of the rural counties won't have nurses. They won't have doctors to be able to provide the medication. That's going to be the problem.
Thank you.
I took up a lot of time.
That was 5 minutes.
I don't have to say very much. I don't have much time anyway, but there's good breaking spots in here. I won't go back very far. I had a couple, last week we talked about last month we talked about how many representatives and senators we have. And there's the forward button. Okay.
I'll try it.
Okay. And we got that, and then we included it in the minutes last time. So that's the thing at the top of the list. Find out who you are, where you are in the political system.
You want this, Roger?
Hmm?
It's easier for you.
Oh, that's where that was.
It was working. So.
It'll work.
Yeah, the next step after you find out where we are in the political spectrum, where our elected officials are, where we live, who we need to contact with, to really come up with what our issue is going to be. So there's suggestions. I just heard another suggestion today that we ought to maybe campaign for additional funding for the jail so they can do corrections work instead of just housing work.
Like how you talk.
You know, I come up with a few others, earlier, just as suggestions that, you know, the state doesn't provide meaningful services for about, especially for children, for about 80% of the state. I think there's only 6 counties out of 36 that actually have full array of services. Anyway, then I can't remember what's on these slides. But what change do we want? So we need to come up with a specific goal. Like I said, invest in more jail services and invest in some services.
Children,
Children.
for children.
Right. Especially the residential. There's still a lot of talk going on between several parties in this state, or in this part of the state in the county, that we may still get a residential treatment facility for women.
Where's that at now? Just Portland? Is Portland the only place for?
I think there's one in Corvallis
Yeah,
too.
there's Corvallis.
Wilmeth or Corvallis,
Yeah,
and then
I've been there
Portland.
before.
Yeah. But that's about it, not very many. And when I say 6, it's not means there's not all 6 counties have that, but what they do have is spread out in those 6 counties on the west side. So it's take some time now to, when we're coming up with what change we want, what we want to campaign for, what we want to advocate for, is to really analyze the issue. There's a process called SWOT, S-W-O-T. I think everybody's probably gone through SWOT training somewhere in their schooling or in their job. Just strengths, weaknesses, opportunities, and threats. Look at all those things. There's actually a SWOT for you individually. And I've got some, and I actually emailed everybody copies of some handouts because I had a little communication difference with Dana this morning. And I have some more copies out there. And it's always, you know, there's times when just overcoming the fear of talking to people. And sometimes being able to tell a story without breaking down is difficult. I have that trouble sometimes. So that's kind of what the SWOT analysis is on your personal readiness to share your story, be able to be impactful. You do want to have, you know, emotion in your story when you talk to the policymakers, but you don't want to break down. So it's somewhere in between. Trying to figure out where these notes. When I did this at home, I had the notes right alongside. So I just printed some off because this was set up different than what I practiced. There's some other instruments to do that with. There's a pest analysis, much like the SWOT. The political, economic, social, technological differences, things that need to change. There's situational awareness. Anyway, all those things will help you, help whoever you're working with. Most of them are for groups more than individuals to try to go through that, because there's a lot of research to go through to analyze what it is we want, what needs to happen, what are some of the ramifications of it. Oppositions. So those are the, like I said, most of those are better suited for groups to find out all those things. Individually, just want to be an individual advocate. Telling your story is going to be the most important part. Oh, and you always identify who can really make the change. It doesn't always have to be at the top. You know, the Congress has responsibility for some things, the legislature has responsibility for some things. Board of County Commissioners have responsibility. Department heads have responsibility, and sometimes even the supervisor on the streets can make some changes to help your situation. I'm going to have you just read those handouts. And I'm gonna save the part for telling your stories till next time. Because we're running out of time, and I'll be here again next time. So just good break point, but anyway, when you've identified what your complaint, what the problem really is, and what you want to change, how you want to change, things that, make the change, and it's time to take some action and do those things we talked about in the 8 points last month of attending a town hall, writing a letter, making a call, arranging a meeting and telling your story. And I put town hall up there, but we're in a point from here till November that we're going to have lots of opportunities to address people running for office and campaign settings and the whole situation. There's another word for that. But in the interest of time, I'll turn this over to Julie.
Okay. So last month there was some discussion about maybe including a young person in this meeting. And we didn't really know what that looked like, but it seemed like everybody was kind of receptive to the idea, so that maybe we could, learn from a young person as well as provide them with some tools that they could take back. So Holly put me in touch with someone at Oregon State University, Cascades, and I don't have the person's name, and I'm sorry, but she and I emailed back and forth. And she would kind of be the decision maker, and she was extremely interested in the idea. I mean, she was like all over it. She said, "What does that look like?" And I said, I don't even think we know what our options are. So I just kind of wanted to throw that out there and see, she said, would this person be a board member, or would they just be attending the boards? There was some talk about calling it an internship, so perhaps that person could get some form of credit. What would their involvement be? And who would we think would be the type of person that we would want? So of course her question was, is this open to anybody at OSU Cascades who's enrolled, or is it somebody who's going after a psychology degree? Or is it somebody who's enrolled in the psychology degree program, but is an upperclassman? So somebody who has a few more years under their belt. And I said, I'll open it up to the group, find out, get a little bit of feedback, and then I'm going to go back and have coffee with her. We both agreed it's too late to do anything this school year, but would love to be able to roll something out to her, this summer, that she could be rolling out in the classroom, in the fall at the very beginning of the school term. And then, if there's no interest, that's one thing. If there's a lot of interest, there would probably have to be a selection of that person. So any thoughts from anybody? Yeah.
I just want to say, I brought that up last time, and I was actually looking at high school level, just somebody who's.
We had Katie West on, who was from the Redmond Proficiency Center, and she was great. So yeah, I thought it was
I
really,
think both things are.
both of them were really good.
Are great, but that's what I was thinking back to the RPI representative.
Yeah, either or doesn't seem to be the right stance.
Right.
I think either or both, and I think we have experience, so I do think we're not starting totally from nothing. I mean, she sat on, I mean, as a board member, right?
She was, I believe so.
She was involved in everything. I think the other, when you were talking about where in OSU Cascades qualification, I would also include lived experience would be, because there could be just a, OSU Cascades student who either has a loved one or they themselves has had, like lived experience, with mental health interactions. I think that's an important piece.
And don't forget COCC, they've been in the community for 75 years
Well,
this
and
year.
they have their whole peer program now too, so that's, but I think having multiple levels of different ages is important. So I think it's great. I loved having her voice when she was here.
We have resources on this committee to provide some mentoring and some liaison with whatever school these people come from to improve the experience and make sure that at least we open the door for people to carry away something from their involvement here.
Good question.
We don't have anything like
Well,
that.
not right now.
Well, I'd say it does look good on their college resume, for sure, for those who aren't already in college. I know that that's something that they're able to put, that, that's a big thing when somebody's looking at those, the work that they've done, to say they've been involved with a behavioral health advisory board.
Yep, well, 4.8 grade points and
You gotta have some.
6-page resumes.
Yeah.
Cascades Academy, for kids for their junior year, 11th graders, we have a mastery program, which is essentially a year-long internship. So I know for our school, it's built into our curriculum to allow students who are interested in different fields to gain experience. So I know at least that, so probably like RPA, Cascades Academy, I know sometimes we're a private, we're an independent school, and sometimes maybe, well, I wouldn't discount just when you're looking at high school students, because it is actually built into our program.
What's the program called?
Cascades Academy.
No, what's the
Mastery.
year-long internship program
It's called
called?
Mastery.
Mastery.
In junior year.
Right.
I think each of the, so with the Mosaic Community Health hat on here, each of the high schools and schools that have the school-based health centers usually have a youth advisory council too. And so those are kids who have certainly displayed an interest in being a part that includes behavioral health through the county and Mosaic. So that's an option, as well as kids that might be interested in participating.
So let me ask a question. Does everybody want one person to start out? Do we want to do this and have one student, or do we want to have 3 students and see how it goes? I think the mentorship and the partnership, a board member partnering with these students would be essential, because they wouldn't know what they were doing, I would assume. And then they would need some direction about, what's expected of them, what we're hoping, there's a lot to do.
So this is a great conversation, and I have a few thoughts about it, just hearing this. Number one, I thought we were talking about high schoolers too, but when you talked about the college, I really liked that as well, because I was seeing some potential barriers to bringing on a high school person, which doesn't mean that can't happen. But what I'm thinking, and I like the mentorship and I like the credit part. I think Holly had also talked, there could be some financial reimbursement. And you were going to get back with this woman around a plan around summer. So what came up for me is that perhaps we need to actually develop something for this position, right? And part of that's going to be what are our learning objectives going to be for that person, so that they do come away with an enriched experience. And also, what was I thinking? How are we going to recruit so that's equal among the county, so that there's not like, you pick this school arbitrarily and now this school would like to have some input. a little bit about the selection process and how we get this information out to our community so that it's fair among each other. And then, if there's a high schooler, the one thing that I was thinking about is how do they get here at their lunch, right? Do we want to then change it at a time that's out of school? I think we need to think about that. That was kind of like the primary barrier I saw as time. Dana and I had a brief conversation. I crossed wires and wasn't able to connect with Roger, but looping back up an agenda item, having a board opening. Let's see, I lost my communication skills. Therefore, I would also think that the youth position would be a dedicated board position aside from our other board positions, so that if we don't have a youth here, it doesn't mean we don't have a full board. Hopefully I got my communication back. So since it seems that this is a good idea, in my opinion, that I would advocate developing more before we implement. Because we really want this to be an enriched experience for all of us. You know, I need a youth vote. I'm the youngest person I know, and that's really scary. So I need that. And then, but we want it to be reciprocal. And then also when we're thinking about the type of student, I guess after Captain Schultz presentation, I was thinking, how about somebody who's interested in politics? Because a lot of these things, I'm not that person, but there are a lot of people that need a macro passion for this work to get laws changed and money to drop down and bringing the vision. I'm more of a one-on-one person. I don't have the patience for that type of work, but that might also be the type of candidate we would bring in, because they would understand legislation. They could, you know, get to know some of the community politics, really. So that's kind of what came up for me.
You're at like a subcommittee, and I'm sorry, I do have to leave.
Would you be interested if
I
we
would
had-
love to be part of like a subcommittee that's looking at developing. I think even for high school, we'd want to wait until September, like the new school year, and kind of get something really in place. And I'd love to be part of it. And
Thank you,
again, I
Jill, because
apologize.
that's kind of where I was leading. This might be one of those offset.
My only point was, I just want somebody that wants to be here.
Yeah.
Not somebody that just is
Has to be here.
part of my program.
Right. So are people, do you think we should move forward with a subcommittee to meet my favorite number of times, which is 6, to get them together?
At least 6, huh?
Most, 4 to 6,
Okay.
we get it done.
Maximum of 6.
Okay, I have a question here.
Yeah, of course, I'm not part of the committee, but I have a question just regarding the type of person or individual that you're searching for. Exactly what would they be doing? Was there a requirement?
Well, that's what we were just talking about. Is actually developing a subcommittee so that the end of it, that we can develop this position so that it is enriching to the youth, whether it is a college student or a high school student. So we'd have to develop what that board position would look like.
Just wanted to segue into that a little bit. I have a associate's degree from COCC in addiction studies. Part of that degree, when I acquired it, was the requirement that I go out into the community, and I did work for Bethlehem Inn. I had an internship with Serenity Lane in order to be able to, and had to basically work for free, but it also helped me to obtain that degree. And so that kind of thing is available.
Yeah, that's a good piece. So,
Can I say something? I see it slightly differently, just based on who we had before. I think, well, and one, it's a lot of extra work. I mean, I'd love to be a part, but I can't commit to another 6 meetings. I thought it was great having a representative, whether it's high school or college, associates, bachelor's, doesn't matter. Just a youth voice who has an interest, a passion, and potentially a connection to behavioral health in the larger picture. I think it's important to hear from their perspective how they feel about, you know, the homeless situation, or when Captain Schultz says something about, you know, any high schooler can find drugs, and I'm like, yep, you know.
Yeah.
I think having that voice is really important. And I will say I have some concerns with it being from a private school. I think that's less representative of the county. I think it's very narrowed. Not saying there couldn't be someone, but I have concern about it. But that's just my 2 cents. I just think hearing the voice of a different generation around these topics we discuss is really what's important for this group, so we can hear. We all have I mean, if you look around, we all look pretty similar. So, you know, just having somebody who can bring a perspective that we don't have. And you know, age is one of those. Generations.
I'd like to add something. So from my perspective, this is just my opinion. And I would be happy to be a co-chair for this because I think it's a pretty cool idea. I'm not a big fan of a high school student. I had a high school schooler, and you know, I think that and he was actually a high functioning, you know, honor student. They have a lot on their plate. Would they really be able to put in the time and dedicate their energy to it in high school like a college student would, who has decided they're interested in psychology? So I'd rather spend my time mentoring somebody who has already decided behavioral health is what they want to do. Maybe in high school, they've taken a psychology class, but in college, they're taking multiple psychology classes. And at that point, that's why when the OSU Cascades gal said, are you thinking of an upper level class person? My first thought was yes. I happen to have an OSU student who's in psychology at OSU, and I'm not telling him about it, and I'm not, it would never be him, but I see somebody like that who's taking all these psychology, different classes, and who is engaged in having meetings and doing their homework with other psychology students. And if, let's just use him as an example, he's in a classroom telling them that he's going to these board meetings and what are the issues you guys would like me to bring up to the group. So I think a college student has more resources, is going to be more serious. And that's personally who I'd want to focus on. I think I missed last month's meeting. So when it came up about high school, I don't think I was here. I was probably moving my aging parents into a senior living facility, which we just did. So I think I missed a meeting when that came up.
Yeah, I mean, from my perspective working here, I would just encourage you to consider a vetting process that might include ages that would be high school or college. And it could be maybe it could be two positions somehow, but I wouldn't exclude high school. It's the right person. I think regardless of their age, and I really encourage us to get some perspective from younger people. We serve children, we serve young adults. I don't think we get enough of their input, and the sooner we can work with them, the better for their behavioral health concerns, prevention. So I just encourage you, whatever you come up with in your subgroup, don't try to narrow it too quickly, and consider your vetting process.
No age limit now. I mean, when we interviewed Kate before, I mean, she was a good fit.
She was a great fit as a high schooler.
And I'm fine with the high school schooler, but what I see is if we do this, it's not gonna work, in my opinion, to have somebody that we say, here's the program and here's what we want you to get out of it and here's what we want in return. Good luck for the next 9 months. I think they have to be partnered with someone on this board.
But this is what
And we need somebody who's willing to do that and commit to it.
what I heard coming up, and I could be wrong, is I automatically go to some kind of structure. That's kind of where I default. What I heard you saying is that to be a little bit more, not free form, but a little bit more flexible in who the person is, lived experience versus how can we help them get their college degrees? And both are good. And that's where, and it doesn't have to be 6 meetings. I mean, that's just like, I don't like a lot of meetings that go on forever. We can do it in 2 meetings. That's even better. But that we spend some time talking about how we do get a youth voice here. And it would be so nice if it was a youth that looked really different than us. And also be able to perhaps give a college age person, because they have, I don't know here in Oregon, but course 199, which is basically an independent study course, and they develop their own and they can get up to 3 units, et cetera, et cetera. But we don't really have a full-time internship, right? We meet once a month, we have sub meetings, so kind of think about that. But like Jill and Julie and maybe one other person could come up with some criteria we could meet, Dana, to kind of come up. Does that sound?
Yeah.
You know, and really,
You'll be on it? Yeah.
okay,
Melinda.
Melinda.
Stephanie, you had something.
No, I think it's pretty much been hashed out. When I just thought it might be helpful to define what we mean by youth. Because when I think of youth, I think 18. I don't think 20-something. And so that's where, when we thought about bringing a youth voice back, I was thinking a younger person.
Yeah.
Not a college age student. But the maturation difference between a 17, 18-year-old and a 21-year-old's arguably negligible, but.
May I ask a question? Just because it would be helpful to me. Can we just do a show of hands? How many people would prefer high school? Because I would rather go after the person that the group is most interested in including. And if it's high school, if everybody I'd be interested in your thoughts. Schultz. Captain Schultz. I'm just gonna call you Schultz, but if getting them younger when I'm fine with that. I just want to make sure
I think your group could come up with that.
Yeah.
Okay. Yeah,
If they're over 21, I'm gonna recruit them to work with us.
20 and under.
I would definitely vote for both, honestly.
That's what I'm thinking.
Like you guys, the mental health issues in our youth right now today, we need to have a connection with them, so.
And perhaps maybe for the 18 and under, we're running overtime, but maybe their board tenure is not 9 months, maybe it's 3 months, right? Maybe that's their bandwidth, right? So that we could have, but as long, because
I don't think we need to decide that though, because there are a lot of kids out there. I have one who are very dedicated to some really serious causes. And if you find the right person, they're gonna be in it. They're gonna be in it until they go to their next phase in life, right?
He was really dedicated as a high schooler.
okay, so nonetheless, there's 4 people. Do you guys feel like either Roger and I need to be there, or do you want to take the lead, which I'm happy for you guys to do?
4, Melinda, Julie. Who else?
Jill.
Jill. Okay,
The fourth.
that's 3.
So Dana, in the past for our subcommittees, she has helped set up a room, and she's had some like this, if you were looking at stuff on the PowerPoint, but the subcommittee does the work. So she can help support the work. She doesn't necessarily do the work.
Set up meetings.
So
3 people can do it.
Well, we can do it by virtually anyway.
I think there was a fourth too.
I thought it was you too.
I thought you were the one who said 6 meetings and all. That's
Throw something out there doesn't mean I have.
That's what I was thinking.
Yeah, Jessica says, not more than 6.
Julie, if you feel like I can give back, I am happy to come, but if you feel like the 3 of you can do it, I am happy to not come.
One thought is, I don't know, I'm probably the newest board member here. I don't know, you've been on for a year or more. Do we need somebody that had the experience with Sarah? Is it Sarah that was the pre-K to kind of know what that looked like, to kind of inform?
It looked like just another board member.
Oh, really?
Just came to the board meetings and she did exactly what we do. It was the same thing. There was nothing extra, nothing less. I mean, she was just a participating board member. It was, from my perspective, it was fantastic.
Is there a way to reach out to her to get
just-
feedback on how that went, and if she had any suggestions?
Yeah, does anybody know how to get in touch with her?
Well,
You have her
What's her
contact.
name? Kate what?
West, WEST.
I have her email.
Went to college somewhere. I can't remember.
Maybe good to reach out, like what was.
I'll reach out to her if somebody gets me her number.
Left. I think she went
Okay, so
Sacramento.
No, I need to kind of wind this down because I have a 1:30 meeting, but I already told them that I'm be a little late.
Okay, Julia, I can send you her email.
Let me say one thing about high schoolers. So many people that I've met in 20 years that I've been involved with this, I have no psychology degree, that's for sure. I don't even know what it means, but anyway, how many people made the decision to go into social work and psychology because of the sibling they had
Yes.
with mental
Well,
illness?
that's what you were saying.
They made those decisions in high school. They knew that that's what they wanted to do to try to help their siblings. There's lots of people out there with that mindset.
Absolutely.
So, I'm gonna jump down to and we'll just have to do the updates later, but, we're also looking for an events coordinator volunteer. That would take the lead on kind of identifying the events that we want to be present at and, encouraged others to go to it. So that's so I would talk more about it, but we're running late. But anyway, so that would be another kind of, not a subgroup, but just somebody among the board that would be willing to take the lead on that so that there can be so that there's not missed opportunities for our, okay. Sorry, I have to get up and walk out, but good meeting. And I didn't quite get enough of your presentation.